Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. So glad that you could join us once again today. Our guest in studio today is Mr. Stephen Powell. He's the Chief Executive Officer and President of Synensis, a healthcare consulting firm dedicated to helping hospitals achieve zero preventable harm. And he's a recognized leader in the development of practices, behaviors, and strategies that improve organizational outcomes, and is a member of the development team that created the Team's Steps teamwork and communication system for healthcare organizations. He's also the co-author of the Patient Survival Handbook. And he's here today to talk with us about taking charge of your healthcare, being proactive, and how a lack of communication among our healthcare professionals can sometimes lead to sometimes fatal medical errors. How are you doing today, Stephen?
I'm doing great, Neal. Thanks for having me today on the show.
Thank you. I was looking at information when I came across your name, and it was saying that medical errors is the third leading cause of death in the United States. We're not talking about a single disease or some type of illness. We're talking about mistakes are the third leading killer of those of us in the United States.
Yeah, exactly, Neal. That's a big number, and I think it's really hard from an awareness standpoint. It doesn't get the attention that, number one, heart disease, number two, cancer gets in this thinking. And so it's not on the top of everybody's tip of their tongue, and they're not thinking about in those other diseases. We're thinking about, what can we do to, make ourselves healthier, to prevent, becoming ill due to one of those maybe a disease factor that like exercise or diet that might improve an outcome for us, or something we can do preventive-wise to improve our health. I think really if we believe the numbers, which there's been a significant amount of research done in this area of patient safety and quality now, and also we're learning more as we develop other ways to uncover these errors, which have generally been buried inside of our healthcare system and not as prevalent. And also these errors occur to one patient at a time, and in various ways and different outcomes. But these are things that we would recognize probably when we think about, when I say some of the common causes, like things like hospital-acquired infections, or suffering a fall while you're in a healthcare facility as a patient, because of maybe a medication or a falls assessment that wasn't completed, or developing a pressure ulcer in a nursing facility. We could all probably think of either ourselves or a relative that or close friend that may have had something like that happen to them. These are preventable. In the most part, we've found that these are preventable medical errors, and these make up some of those almost 400,000 lives that are impacted by medical errors each year in our country alone.
Now, hospitals have been around for quite a long time. Mistakes have been made for quite a long time. As scientists, don't doctors learn from mistakes that are made, putting new discoveries into practice, on a practical level to prevent these preventable mistakes? And with the technology that we have, how are so many of us still dying from these preventable mistakes, not mistakes that, that were under no one's control? Something exploded and everybody in the OR died. But these are preventable mistakes. How are they still occurring?
Well, I think we have made a lot of strides in our technology, our equipment, some of our practices. But I think some of the challenges, Neal, are kind of some simple things that are more behavior based. And when we look at the serious safety events like these deaths or serious injuries, some people in the industry call these sentinel events. What we find is from the data that the top four leading causes of these aren't really related to kind of a medical technology. They're related to the number one category of root cause is human factors, and I'll go into what that means, what human factors are. But they're really the fact that we are human and we make mistakes, so we can talk more about that. Next is communication, which I know we'll get a chance to talk more about that. Leadership, and then finally this area of assessment. So actually, diagnosing and having this what we'll call situation awareness, have a full understanding of the patient's conditions, and then understand how best to treat the conditions that the patient presents with. So sometimes that's also related to some of the lack of good information that's not available to the practitioner. Sometimes that's preventable, sometimes it's not. In the case of an emergency room doc, that may not be easy in any case to get all the information out of a patient that presents after, say, an automobile accident in the ER, and we don't have all the information. But those are the 4 top causes, and they're not generally related to what we would normally know as our professional technical skills as doctors and nurses, like our ability to technically do a procedure or to deliver the right, IV placement or central line placement or whatever therapy we're receiving. It's more about our non-technical skills, our ability to be good teams and communicate.
Now, let's talk briefly about your company, Synensis. You're the president and CEO of Synensis. And while we're on the topic of preventable zero errors, what type of training, information, or either supplying equipment do you supply to healthcare facilities in their efforts to attain zero preventable errors?
Well, what we try to do, or we have been doing really for the last over a decade now, with over now 500 organizations, we work across a wide spectrum in over 17 countries because, honestly, Neal, this problem and challenge it doesn't know any borders, right? Because humans are humans no matter where we go on the planet. And so what we're trying to help organizations do is, number one, realize that human error is inevitable. We cannot discipline or punish our way out of this problem. So what instead we're doing, helping organizations do, is we're helping them to, number one, design better systems of care with the human factors in mind. And there's a very comprehensive body of evidence on how to do that. And other industries have actually embraced this more widespread than healthcare has in the past. Other high-risk industries like aviation, nuclear power, and the military, for instance. So that's the one part. Yeah, and then I think second with that, I'll tell you, Neal, one of the other really key part of that is to achieve better outcomes, really, which is to prevent these preventable errors from occurring, is also helping organizations understand how to help their healthcare professionals and staff leaders make better choices each and every day as it relates to the continuum of care. So along with those safer systems and better designed systems is also making better choices. Those choices that are directed more at really focused on that patient and their experience of care more so than our own personal choices, if you will, that make things better for us, but not necessarily better for the patients.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard. In studio today, we've been talking with Mr. Stephen Powell. He's the CEO and president of Synensis. He's an international patient safety culture expert and a recognized safety and quality leader who leverages the power of safety culture to drive results, develop high reliability teams, accelerate quality improvement, and reduce medical errors. And he's been involved in human factors education and teamwork training in the United States Navy, the commercial airline industry, and the healthcare industry for over 25 years. And he's been here with us today talking about some of the reasons that preventable medical errors still occur and some of the ways that his company is helping to stem the tide of preventable medical errors that often end in fatal results. It's been great talking with you today, Stephen.
Thank you, Neal. I really appreciate the opportunity to talk and speak with your audience as well.
Thank you. Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.